The population groups that most readily require probiotic therapy include infants, children, pregnant women, adults, and the elderly. However, do these groups require individualised probiotic treatment? Some strains have found to be effective across all of these age groups. These include Bifidobacterium breve M16V, Bifidobacterium infantis M63, and Bifidobacterium longum BB536. In fact, BB536 is one of the world's most scientifically documented human bifidobacteria. Numerous scientific trials have been conducted on these strains for various clinical applications, including Candida, D-lactate-producing pathogens, pneumonia, eczema, upper respiratory tract infection, hypercholesterolemia, and gastrointestinal and immunological conditions. By supplementing with these strains, you can greatly simplify your prescription, as well as reduce the influx of age-specific products causing stock inventory issues within your dispensary. These strains can improve a number of conditions affecting infants. BB536, M16V, M63, and Lactobacillus rhamnosus HN001 have been found to reduce the development of eczema, severity of atopic dermatitis, incidence of rhinoconjunctivitis, and respiratory tract infections, and also improve the microbiota of low birth weight infants, and many, many more. Recently, a clinical trial labelled as a landmark achievement in the history of Australian neonatology was conducted at the King Edward Memorial Hospital in Perth, administering 3 billion colony-forming units daily of M16V to 160 neonates. This trial concluded that M16V was well tolerated and showed an affinity for the infant gastrointestinal tract, with elevated intestinal levels of bifidobacteria detected in the treatment group when compared to the placebo group. A recent clinical trial concluded that M63 has the ability to enhance the colonisation of BB536 and M16V through both the formation and maintenance of these powerful bifidobacteria colonies. In this way, M63 becomes an enabler of enhanced gastrointestinal colonisation of these two incredibly broad application strains. In addition to the effects of BB536, M16V and M63, HN001 and HN019 have been found to have an effect in children, with these specific strains showing potential for increasing intestinal IgA secretion and growth rate, decreasing respiratory tract infection by 35%, decreasing pneumonia by 24%, and preventing atopic diseases. A 6-year study that prescribed 6 billion CFU of HN001 from 35 weeks gestation up until 2 years of life reported a 50% reduction in infant eczema prevalence, as well as a significant protective effect on rhinoconjunctivitis and a protective effect on asthma symptoms. An additional use for probiotics is during pregnancy for the symptomatic improvement of gastrointestinal issues that can affect expecting mothers. Probiotic use during pregnancy can have many beneficial effects for both the mother and infant that may prove to last through early childhood. A human clinical intervention trial conducted in 110 pregnant volunteers, which administered 10 billion CFU of BB536 daily, yielded impressive results, such as a 60% improvement in flatulence by the 4th day of treatment, and a 76% improvement was seen in subjects complaining of constipation. Neonates of mothers taking 6 billion CFU of HN001 have been found to have higher detectable serum levels of cytokine interferon gamma, whilst in the mother's breast milk, immunomodulatory factors were also found to be influenced. In adults, research has found probiotic strains to assist in the management of Candida overgrowth, D-lactate accumulation, as well as the management of allergies, asthma, and pathogenic infections. In an open-labelled clinical trial, 2 billion CFU of BB536 was administered to patients with Candida infection. The group experienced a lower number of Candida cell counts. Less than 174 million CFU of BB536 taken daily for 8 weeks has also been found to significantly decrease the cell numbers of enterotoxigenic Bacteroides fragilis, a pathogen associated with delactate accumulation, persistent diarrheal disease, inflammatory bowel disease, and colorectal cancer. A randomised double-blind clinical trial conducted in Queensland over a 5-month period administered 2 billion CFU of Bifidobacterium lactis BIO4 for respiratory illness. The findings of this trial concluded that there was statistically significant risk reduction by 27% in any upper respiratory tract infection episode in the treatment group. The prescription of HN019 at a dose of 1.8 billion CFU for 2 weeks reduced whole gut transit time by 25% and reduced frequency of many common upper and lower gastrointestinal symptoms such as abdominal pain, irregular bowel movements, and flatulence. In population groups 60 years and over, specific probiotic strains help to maintain intestinal microbiota as well as improved immunity, with HN019 elevating proportions of T lymphocytes and natural killer cells. In elderly populations, low doses of BB536, up to 400 million colony-forming units, have been found to significantly reduce LDL levels when compared to the placebo group, implicating its use in hypercholesterolemia. Australian clinicians can now rethink the need to prescribe different strains for different ages, and instead choose innovative, unique, and powerful probiotic strains that are supported by hundreds of strain-specific clinical trials, relevant for everyday practice, and efficacious across all ages. For further information, please visit www.bioconcepts.com.au to view our multi-generational probiotics application chart.